And welcome to the Research Works podcast, brought to you in association with Curtin University and the Healthy Strides Foundation. Your hosts are Dr. Dana Poole and Dr. Ashley Thornton, and together we will interview world-leading researchers in the area of child health to support your practice in being more evidence-based.
Today, we not only have the lead author of the paper titled Digital Rare Diseases, but we really do have a world leader in the area of rare disease. Clinical Professor Gareth Baynam from Perth Children's Hospital and Telethon Kids Institute. Welcome, Gareth.
Thanks so much for having me.
Welcome. My goodness, we are thrilled and we're just so lucky to have some of Gareth's time because rare diseases is increasingly recognised as a global public health priority, and as clinicians, it can be quite confusing about what constitutes rare diseases and what does it actually mean for us when we're working in the field. So whilst we'll be talking about one main paper today that Gareth authored, we'll be dipping in and out of other papers that help to bring the depth about this whole topic, because it really is an important area to talk about.
Absolutely. And just a quick introduction for Professor Gareth Baynam. Let's just say he has an H index of 33 with over 4,500 citations. So that should that alone should give you a really good idea of the breadth of his work. But to give you a bit more of an idea of the work he's involved in and the influence that he has on the industry, Gareth leads teams with partnerships that have advanced the frontiers of genetic and rare disease diagnosis and care integration, cerebral palsy genomics, epidemiology and related health system monitoring and planning, and associated policy leading to sustainable implementation of a coordinated suite of initiatives both locally and internationally. His work has seen the advancement of equitable and precise healthcare through translational, transformative and community co-designed and engaged research, such as Cliniface and life languages, which I'm really keen to learn more about today.
That was quite a mouthful, and I'm glad you had to do that, because it was actually really hard to summarise all the things that you do, Gareth.
Absolutely.
And my claim to any degree of this knowing someone like Gareth is the fact that when we were doing our study back in 2015, we were at PMH and Princess Margaret Hospitals, a really small clinic area, and every Monday morning, I remember feeling really bad by the fact that we were singing so loudly to get kids to step on the treadmill. And I'd see Gareth coming in and out of clinics, with a genetic counselling. And I was like, we must be great entertainment for you. But, I think maybe that spurred on some ideas or something along those
absolutely.
lines.
It was such a great way to start the day to hear those joyful noises. It really set the scene beautifully.
So, Gareth, the way we like to start our episodes is with a little bit of an icebreaker question. And the question that I had for you today is, as well as a good singer, what are 3 words that your friends and family might use to describe you?
Well, they definitely wouldn't use great singer, nor would they use great dancer. I don't know. Maybe caring, sleepless, a little bit crazy.
I like that. What about you, Dana?
That's really hard. I'm going to use 2 of those 3 words in one way. I would say repressed extrovert.
Mm-hmm.
And I would say probably, I love food, so I don't know how to put that in one word. A foodie. There we go. A repressed extrovert foodie. Does that make sense?
It's beautifully summarised, I think.
What about you, Ash?
Oh, I think they would say I'm stubborn, calm, and kind.
Yeah, I would agree with, I can't say stubborn. I feel like that's a very personal thing to say. But I think calm and kind are very good words to describe. And I'll let your family say about the rest about the stubborn. But it's great you recognise it.
Yeah, I definitely recognise it. But we really want to make the most of our time with you today, Gareth, and we've got so much to cover. So I think we should get straight into it.
Absolutely. Okay, so starting from a really high level, Gareth, can you define to us what is a rare disease? Like, how rare is rare?
Well, rare diseases cumulatively are really common. Mm-hmm. And so they're the common cause of suffering and the most common cause of death in children. Mm. They're diseases that are individually just that rare. So we use the European Union definition. Essentially, the individual diseases affect 1 in 2,000 people or less, but they're also really complex. So there's a qualifier around the complexity of them, essentially that they need multidisciplinary care.
Yeah.
They're frequently characterised by, as I said, suffering, disability, be it mental ill health, be it a physical disability, be it intellectual disability, by uncertainty, by isolation, by the need for connection. They're also characterised by transformation. So the diseases are terrible. The suffering is enormous, both on the children, the families, the extended family, the community, but also from a medical system, service innovation, translational research perspective, because of their severity and because of the dynamics of the conditions and the community and how well aggregated they are, that they really are an amazing domain for solutions, not just for people living with rare disease, but for all people.
Yeah. And I feel like with rare disease, when you talk about the incidence of them individually, but collectively, we sort of talk about them as a whole because, can you talk us through that a little bit in terms of what it means as a whole?
Yeah, absolutely. So, I mean, a number of people will have heard of individual rare diseases, things like Duchenne muscular dystrophy, spinal muscular atrophy, Huntington's disease, early onset Alzheimer's. But there's about 8,000 individual rare diseases. And really that word rare captures it all. Yeah. It's the fundamental thing is the rarity. And what that rarity means is that an individual doctor or be it a general practitioner or a specialist or an allied health professional or a social worker may not have encountered that individual disease before, or they may well have, but not recognise that that's what it was.
Yeah.
Either in the last year or the entire working lifetime. So that creates enormous challenges for getting a diagnosis, and then B, care coordination, because without a diagnosis, without a label in particular, it's really hard to tick the boxes, as it were, for care provision, for insurance, for disability services. That rarity also creates this incredible emotional isolation and mental health burden because people intrinsically need to connect, and to share experiences and share solutions and share troubles. So that again, that rarity is a challenge. And then when we think about rare diseases, it's all those commonalities, and there's so much that we can do that addresses the common challenges across the different rare diseases. And then there's the specific things that can be done for the individual diseases. But again, I come back to it's the common features across those conditions that cumulatively we can make so much difference with.
Yeah. And when you think about the impact of rare disease, could you talk to us a little bit about what impact rare diseases have on the health and well-being of not just the child but the family as well?
Okay, so imagine this. Imagine that there was a global health crisis that affected every country. Imagine that there was emerging threats, that there was diseases that needed new paradigms, new ways of treating things, new social responses, new treatments, that people were feeling increasingly isolated, needed to connect, had been dislodged, removed, almost become homeless or stateless from their normal state of being. That you needed new therapies, that you needed new vaccines, that you needed new ways to approach the mental health burden of the isolation. That is rare diseases. And the world is now experiencing what it's like to live in a small way, in a very small way, because we're not talking in the COVID setting, we're talking about something that's a limited phenomena. As terrible as it is, and it's truly terrible. But this is a limited phenomena. And there are vaccines. There are treatments. So if we then take that and then compare against rare disease, these are lifelong debilitating conditions for which 95% have no specific treatment that affect every single domain of your life. So now think about what that means for mental health. Now think about the situation where if we look at policies, strategies, guidelines, that they're silent on rare diseases in the mental health domain. How would you feel?
Gosh, that's such a powerful analogy, really.
Absolutely.
Isn't it?
Yeah, when you put it in that context. And I think that is a really good context to put it in because we're all living, in this era of COVID at the moment. But like you say, for families of children with rare diseases, that's that's every day, isn't it?
Absolutely is. And then, to put some numbers on this, because I think it's important to put some numbers, just in terms of the sheer number of people affected. If we take Western Australia as being a really small population, 2.5 million people, there's 63,000 kids living with a rare disease in a very small, globally, population.
Yeah.
That fills our biggest sporting stadium.
Yeah.
And if we think about globally the number of people living with a rare disease, it sort of be between sort of 300 and a bit over 400 million. So it's an enormous number. It's an enormous number of people. And then you can just imagine the impact across the lifespan of those conditions, the impact on the economy, on the health systems, on the social systems.
Yeah.
And we've seen some really enlightening data come out. Some of which we did in Western Australia here, but led by the Office of Population Health Genomics, which looked just a subset of those rare diseases, 500 out of the 8,000 rare diseases, and showed that 2% of the Western Australian population had one of those 500. So just a subset, not the entire.
Wow.
And that they were 5 times more costly than non-rare diseases.
Yeah.
So it was a bit over 10% of the hospital inpatient budget attributed to that.
Yeah.
To that 2%. That's $400 million a year, just for a subset, just for inpatient admissions. That's not outpatient admissions. That's not indirect costs. That's not absenteeism, presenteeism, mental health burden, any of those things. And we've seen this year data coming out of the US that when they looked at direct and indirect costs, and now we're factoring in all those absenteeism, presenteeism, et cetera, that was nearly $1 trillion in 2019.
Oh, my goodness.
So to give you an idea of that sort of number, that's fold times things like obesity, cancer, Alzheimer's, diabetes.
Yeah.
So it really is enormous.
It's huge. And I'm really interested in, when we're talking about the impact of rare diseases, what other effects it might have on the health system and health professionals who are working with these families?
Yeah, I think that's a really interesting question, and I think it's always the most important to concentrate on the effects on children and families in the community. But equally, there is a massive effect on the health system and practitioners and system administrators within that system that again comes from this uncertainty and again comes from this lack of coordinated response. And so we're seeing some really promising things emerge in terms of improving a sort of a coordinated response, but still largely that's a huge area of need. And I think practitioners feel some sort of level of discomfort when there's uncertainty. I think we all do.
Yes.
And so when they're confronted with, say, a child with a rare disease, when they really don't know what's going on, what's the pathways for them?
Yeah.
What's the, and for the practitioners even to think about, could this be a rare disease in the first place? And then think about, okay, if it is, what are the sort of principles and pathways and things that we need to do? How do we connect? How do we really best help these families? And stop them going on a sort of both a diagnostic odyssey revolving around trying to get an answer for the condition, but also a therapeutic odyssey. Where do we go to access services? What are the best practices for this condition or this group of conditions?
Oh gosh, yeah, that was my next question. You hit it really. In terms of, you do hear about this diagnostic odyssey. Can you talk us through what that actually means? There are some numbers and stats around how many health professionals families might encounter in getting a diagnosis.
Yeah, I think there's these very real stats. That on average for a child with a rare disease, it takes 5 to 7 years to get a diagnosis, and that's just for the ones that get a diagnosis, and more than half at this point in time don't. Right. And we know that if we take a lens of adults, that 50% of the time the initial diagnosis was wrong. And I'm as guilty of that as anyone else, at least as guilty of that as anyone else. We know that 2/3 of them saw 2, 5, 10, 16 or more doctors on the way to getting a diagnosis. So just imagine that. Imagine that. Imagine that, Jenny. Yeah. And then if you think about, for instance, a little girl called Lily. She's Lily and her family are very public, and Lily was the first child we saw through something called our undiagnosed disease program. And Lily was 7 when we saw her, and this is again one of my examples of my many failures to get a diagnosis early for a child. And I'd been seeing Lily since day one of life.
Wow.
And she had a really complicated course, in intensive care. And then by the time she was 7, she had 50 hospital inpatient admissions.
Wow.
250 outpatient visits. 14 diagnostic general anaesthetics. So Lily's, we still live in the world of paper notes. And Lily's stack of notes was taller than Lily, weighed more than Lily. And so just imagine that journey for Lily and her sister and her family and the concerns of her aunts and her uncles and her grandparents.
Yeah. And what are I know there's many, but, what are some of the main barriers in getting a diagnosis?
Well, the first and most important one is awareness.
Sure.
So people often don't even think about the possibility of, could this be a rare disease? And there's some really good sort of red flags to think about whether that's the cause or not. Is this, particularly a child, is this a multi-system illness, affecting lots of different parts of the body, needing multiple specialists? That's a pretty good flag. It's probably a rare disease.
Sure.
Are there multiple family members with the same unusual presentation?
Yeah.
Are there multiple congenital abnormalities, multiple differences present in birth, hole in the heart, cleft palate, spina bifida? And are there moderate or severe intellectual problems? Is the child's condition regressing? Is it going backwards? Does this look like a really unusual presentation of something you see commonly, but it's just happening really, really young, or it's really, really severe?
Sure.
Then all these things are, and particularly if there's any combination of things, are really good red flags to say, look, this could well be a rare disease. But it's actually getting that information out to the communities, to the families, to people, and also to medical professionals in a way that sticks. So that awareness piece is huge. And there's some really exciting things coming online about them. One's something called Rare Navigator, which is really a way to raise awareness and to arm families with a toolkit and a set of resources to have the right discussions with the right people and progress along the journey. So one of the many sort of digital health solutions, if you like, in this domain that are either existing or emerging. And then there's access to diagnostics, and by that I mean people as well as technology and kit. People that are skilled in the understanding of the different diagnostic tests, be it genetic tests or other tests, and can provide that in a way that's resonant and tailored to the family's journey. That has the pre and post test counselling, as well as just the provision of the test itself and interpreting the results. And that access issue is a workforce issue, and it's a funding for the genetic tests issue. And it's great to see, there really are kind of improvements in this, but there's a long, long way to go. And for such an enormous unmet need, the relative lack of kind of investment. So I think they're barriers or enablers depending on how you look at them. And there's all sorts of new technologies. There's text mining of electronic health records. There's various sorts of facial analysis. There's combining all these things. Together, and connecting the flow of the information. Often the information is collected and stuck in little silos. And so the more we can stick that together in a cohesive, data journey that goes along with the patient journey, the better we're going to get a diagnosis.
And you touched on earlier the fact that, often these rare diseases require, multidisciplinary input. Is that how sometimes that information gets a bit siloed, in that these children are involved in lots of different specialists in lots of different areas, and there's not really anyone to kind of pull all those pieces together?
Absolutely. This siloing across and between specialties, or between data types, or where they're stored, between research and clinical care, between community collections and research and clinical care is a huge issue. And so really there's a human data sharing that needs to occur, and that's people connecting across different disciplines around individual children and families one at a time. That's extraordinarily powerful because so many times, if we take the diagnostic lens, so many times it's that bit of information that actually isn't written in the medical note or is not actually accessible because it's sitting in private practitioners' rooms and it's not connected to the public rooms or whatever. Yeah. And so the more that we can connect people around individual children and families, the better we'll get at this. And the Undiagnosed Disease Program is, in a nutshell, that's what that is. And it's unlocking all those bits that aren't necessarily written down and say, I thought about this, but it didn't fit because it wasn't quite right. And then someone else goes, well, yeah, I thought about that too. Or I thought about this other thing that's really similar to that. Yeah. And it's that sort of knowledge sharing that helps enormously. Then there's sort of data sharing at the level of research and laboratory diagnostics and how we share that information in more efficient ways that still protect privacy to the level and ways and means that are acceptable to the community.
Well, there's a lot to think about there. And, you can already start to think about how information can be so varied in so many different places and the burden that sometimes probably most of the time that comes into the families to try to collect the information that they do get from different sources as they go to see different people. And that in itself would be absolutely exhausting, wouldn't it?
Yeah, absolutely. I think it is. Families are constantly repeating their story, the repository of the information, be it their folders, and sometimes it's these multiple folders that I'm laughing, but it's really not funny. I'm laughing at a discomfort because you're right. That's a huge burden on families. It's also a way of families having control. And that can be empowering too. So if we can give families better ways to do that, and there's some great initiatives looking at that, better ways to collect that information, to share that information that empowers them, then I think that's actually really a really important part of the solution because it's not only empowering, it's fast. Yeah. There are so many rules and regulations and about data and data sharing or ethics or governance processes within big systems. Yes. And whereas, families are the central point. This is the lived experience. And they can be much faster in how they go about things. And in the end, don't you want families to have the most control about how the information is used and shared to enable things? Yeah.
And you can see now why the move to digital solutions, digital health solutions become really important as an avenue to be able to start to share that kind of information as well.
Absolutely. So, Gareth, cumulatively, rare diseases make up quite a large proportion of the population globally. So what are some of the global initiatives that have been established in the field?
Yeah, so there's a number, and I think what we're really seeing now is a global convergence. And so even if we think about big international organisations, so we think of things like the United Nations. Yeah. And so right now, there is sort of a draft proposal for a United Nations resolution on addressing the challenges of people and families living with rare diseases. And it's worded that way because this is about their whole life journey. It's not just about health. No. It's about education. It's about social systems. It's about leaving no one behind. It's about human rights. So, that's very much a discussion that's been sponsored by, members of the various member states of the United Nations. There was a meeting about that last week. Those sorts of high-level discussions and recognising this as a discrete need, that's not yet been adopted. But the fact that it's at this stage of progression and it's been backed by, the various excellencies and highnesses from around the world, be it from the Queen of Brazil or the equivalent of the Queen of Qatar and people like the Queen of Sweden and the Princess of Sweden have been long-term supporters of rare diseases through to leaders in UN human rights, the Commission itself. So, so I think that sort of international level. What also is seen from the World Health Organization, I think is something that's really exciting. And I think it's really exciting for a number of different reasons. So it's an MOU, Memorandum of Understanding between the World Health Organization and Rare Diseases International. Now, why I think this is so exciting is because Rare Diseases International is the peak advocacy group globally for people living with a rare disease. So the MOU isn't with a government, it isn't with a research institution, it isn't with a hospital system.
Yep.
It's with the cumulative global voice representing people living with rare diseases. So I just think that's so cool.
Yeah,
That's really powerful.
Wow.
And what that means is the metrics of how this will all be assessed,
Yes.
the ways that this will be implemented will be driven and guided and led by the rare diseases community.
Yeah.
That's incredible.
So I think that's really incredible. You're quite right. I think that's a great word. And so there are a number of sort of key early, if you like, agenda items.
Yeah.
One of them is the formation of a globally coordinated centres of expertise for rare diseases, and these are really based in universal health coverage. They're based in human rights. They're based in sustainable health systems language. They're really about healthcare provision and sustainability and connection. And then, importantly, then also bridges through to research. So I think this is a really exciting initiative that will formalise this global network. So I think the World Health Organization is an example. I think the World Economic Forum is another example of it's a lead organisation for global public-private partnerships and to see what they've been stimulating in the rare disease domain has been really exciting. Then there, specifically from a research perspective, the International Rare Disease Research Consortium, a bit of a mouthful, ERDC. The acronym sounds beautiful when you say it in French. I think everything does. But that's a global multi-stakeholder consortium. So that's funders, be they public or private funders. That's companies. It's peak advocacy groups. So advocacy groups either represent a country or a region, and all working together to prioritise and say, what are the areas of research that we need to focus on? How do we globally harmonise our research across the globe? And it has three broad goals: a diagnostics goal, a therapies goal, and a how do we assess the impact of all this in a meaningful way goal. And it's really the vision really is that all people living with a rare disease will get a diagnosis and access to best practice treatments within 1 year of coming to medical attention. Deliberately, extraordinarily ambitious.
Amazing.
And so there's that. There's an amazing network called the Undiagnosed Diseases Network International, which again is a global network to address the challenge of diagnosis for children and adults living with a rare disease. It's amazing because of the institutions that are involved, the people that are involved, and the fact that it is designed specifically to be adaptable to whatever jurisdictions, circumstances are. It operates through common principles of practice, but doesn't dictate you must do X, Y, and Z in exactly this order in exactly this way. So here's the principles, here's what we should do.
Yeah.
How does this best work in your environment?
Yes.
So I think, and to some degree, it's a coalition of the willing, and so I think that's a really cool dynamic. So I think there's and I'm sure the Global Commission to End the Diagnostic Odyssey for Children Living with a Rare Disease.
Yeah,
my goodness.
I got that out.
That's amazing.
So that's co-chaired, and here again it's the same dynamic. It's co-chaired by Eurordis, which is the European patient organisation for rare diseases. Mm-hmm. So that's representing 30 million people in the EU living with a rare disease. And Microsoft, and then a rare diseases pharmaceutical firm called Takeda, really getting together and saying, how do we create the technologies, the technology ecosystems, the new digital health solutions, as well as contribute to the awareness, the policy, the coalescence of people, and the standardisation and the curricula, and so that's really exciting. That it's taking a real. There's some really fantastic solutions coming out of that, and more to come. Yeah. And so I think you're seeing. The world's most recognised global bodies, some of the world's most recognised corporations, led by the rare disease community, harmonising globally. So much to do, so many enormous challenges, and such urgency
Yeah.
because of the sheer amount of suffering that children, families and adults living with rare diseases are experiencing daily.
For sure. And I mean, to me, it's impressive that you can remember the names of all of those global initiatives, let alone, the sheer amount of work that goes into, making that meaningful for the rare disease community. It's so impressive.
I have a special combination of dyslexia and ADHD, and so it's taken me probably 10 years to learn those names and those acronyms, and I probably got them wrong.
I don't think you did. No. Well, I think that's about all we've got time for today, but we've got so much more to talk about with Gareth. So we hope that you can all join us for part 2 of our chat with Professor Gareth Baynam next week.
Sounds like a plan. All right, talk to you guys next week. Bye.
Bye.